Hi everyone, my name is Emilee Lamorena, and I'm the Clinical Manager of Respiratory Care at Ann and Robert H. Lurie Children's Hospital of Chicago. And my journey to get where I am today is quite different from most people, so I would love to share my story with you. I was born and raised in Chicago into a very close family. I'm the baby of my family, and I had two parents who were physicians. So you can probably guess what my aspirations were growing up into what I wanted to be. I wanted to become a doctor. And after I graduated from high school, I got into my dream college, which was UCLA, so I moved across the country to start chasing my dreams there. At UCLA, I was a pre-med major, so I was in all my important science classes, biology and chemistry and physics, but I also got very involved in many organizations across campus. So I was in a sorority, I directed several of UCLA's largest philanthropy groups, and I was also in a hip-hop dance group. I'm a professional hip-hop dancer on the side. So I really feel I had a very well-rounded college experience. I studied hard, I was able to dance, I had a great social life, but most importantly to me is I was continuing to give back to my community. And after I graduated college, I knew that before I committed myself to graduate school or med school that I wanted to continue doing that work and working with my communities. So I then moved to New York City, where I was part of the New York City Teaching Fellowship, and I was a high school science teacher in the Bronx. And it was one of the most incredible experiences of my life, and I got so close with my students. I started a dance group at the school, and I was thriving and loving it. And I remember on February 17th, 2010, I received a call from my sister who was back in Chicago, and she asked me to come back home as soon as I could. And that was scary because my family had never given me that kind of call before. So I immediately grabbed my things, ran to the airport. My cousin picked me up from the airport when I arrived and drove me straight to a hospital, where I walked into a room and my mom was in the hospital bed with my family all around her. And that's when I learned that my mom had been diagnosed with stage 4 lung cancer. At this moment, I dropped everything I was doing in New York and moved back home to help take care of her. And it was one of the most troubling and difficult years of my life. Unfortunately, my mother passed away only 10 months later on December 20th of 2010. That was when I learned that I knew I wanted to be in medicine, and I had experienced a lot in working in my parents' offices or volunteering in the hospital, and I could see blood or cuts or other things. But that is really when I learned that nothing in the world is harder than watching someone you love struggle for a breath. And shortly after her death, I was at Rush University Medical Center to fill out some paperwork, and I remember I walked into the hospital and I saw a flyer that said, "Do you want to help people breathe?" And I said, "Oh my God, yes, that's all I want to do. What am I going to do?" And I walked, and it happened to be that day was the info session for their Master's in Respiratory Care program. So I walked right into that information session. I had never heard of a respiratory therapist before, but after that I left and I said, this is exactly what I want to devote the rest of my life to. So somehow I worked very quickly and somehow secured one of the last seats in that program. And within a few months, I was already starting class to begin my master's in respiratory care. I was very sensitive to everything we were learning because of my previous experience. So I was a very serious student, and everything I learned, every diagnosis, every symptom, every patient we learned about, became very personal for me. So I worked very hard throughout graduate school. I was able to graduate at the top of my class, as well as I was still involved in many community outreach programs. And upon graduation and becoming a licensed respiratory therapist, I started my career at Rush in the Children's Hospital in the Neonatal and Pediatric side. And as a respiratory therapist, you are involved with everything that involves the heart and lungs, which is our most important and prized organs. If our heart and lungs are not working, we're in big trouble. So to be able to work directly with that and have a specialization that helps people treat those problems is so rewarding and so important. And being a neonatal and pediatric respiratory therapist, you know, I experienced everything from I was right there at birth, making sure that babies were taking their first breaths. I was right there after they came back from their first heart surgery. I am there when patients have a bad asthma attack at school and they come to us for treatment. I'm there with parents and families as they might receive some chronic or life-altering diagnosis and their lives are forever changed, but I'm there to hold their hand and help both them and their children cope with that and come up with a plan to manage it in the future. As a respiratory therapist, you are given the opportunity to give people what they need most, which is the ability to breathe. And you're there with their families in the most critical of times, and you are able to support them through that. So I truly believe in that what I do every single day matters and makes a difference in someone's life every single day. My career at Rush really opened up many opportunities for me in education and research, and that is how I landed my current role here at Lurie Children's, which is one of the top children's hospitals in the nation and the best in Illinois and the Midwest. And I'm able to lead a team of respiratory therapists and inspire them and empower them to become strong clinicians so we can continue to do this amazing work every single day to every child and family that comes through our doors. So I am so proud of my career. I am so proud of what I do to help others, and this specialization of medicine has meant so much to me, and I dedicate every single day to my mama in heaven, and I hope that you find a career that you are just as passionate about or that gives you as much fulfillment as I have. So thank you for listening. If you have any questions at all, please don't hesitate to reach out, and good luck to you and all your future endeavors, and find your passion.